Good afternoon, everybody, and thanks again for joining us today. In the Legislative Building in Regina, we have Premier Scott Moe and Dr. Shahab. Joining us on the phone from Saskatoon is Scott Livingstone, CEO of the Saskatchewan Health Authority, and Dr. Susan Shaw, Chief Medical Officer of the Saskatchewan Health Authority. Premier Moe will have an opening statement, followed by brief remarks from Dr. Shahab on today's case update, brief remarks from Scott Livingstone on today's update. Then we'll have time for questions. Premier?
Well, thank you and good afternoon, everyone. Today we are reporting 34 new cases in the province of Saskatchewan. 29 of these cases are in the far north, which now has over 60% of the active cases in the province. While that number is very concerning, it means that increased testing in that area is working. We are finding those who have contracted the virus and ensuring that they have the opportunity to self-isolate and, when needed, receive medical assistance. We continue to work with northern communities to get the situation under control through aggressive testing and aggressive contact tracing. Provision of temporary living spaces for self-isolation are being provided, stronger enforcement of our checkpoints to restrict non-essential travel between communities, and community education about safe physical distancing practices is in effect. I want to thank everyone involved in this effort in northern Saskatchewan, the community leaders and the volunteers, as well as all of the healthcare workers and other government workers who are working so hard to protect the people in our northern communities. At the same time, these new case numbers and active cases remain low in most of the rest of the province, and that is good news. And it shows that what Saskatchewan people are doing is working. Physical distancing, it works. But we need to keep doing it because the threat most certainly has not gone away. This virus can and it will spread quickly if we let our guard down even for a moment. Last week, Statistics Canada released an interesting study about layoffs during the course of this pandemic. While the layoff numbers are pretty significant and far and wide across the nation, and every job that is lost, in particular here in Saskatchewan, is very troubling. The pandemic appears to have resulted in fewer layoffs in Saskatchewan than in many other parts of the nation. Saskatchewan had the highest number of businesses, 66%, who experienced no layoffs. And we had the lowest number of businesses, 7.6%, who have had to lay off all of their employees. So I think this shows that we have been able to flatten the curve here in the province, even while most of our population did continue to work in some fashion. Now, employees and workplaces have all had to adapt in one way or another, and that we have seen. More people are working from home, for instance. More are doing business online. They're physical distancing in many different manners. But it shows that businesses and workplaces can operate safely without increasing the spread of COVID-19. And that's encouraging, because today we cautiously start phase one of our Reopen Saskatchewan plan. It's encouraging because, unfortunately, COVID-19 is going to be with us for some time. And we are going to have to find new ways for our businesses to reopen and to stay open, and for employees to be able to work safely. And I think we will be able to do that, because we have already been doing that in many cases in Saskatchewan businesses and in Saskatchewan workplaces. So I once again want to thank all Saskatchewan employers and employees for everything that you are doing to adapt and to keep coworkers and to keep your customers safe. This is important, as today we begin to turn the dimmer switch up just a little bit on our economy. Today is the start of phase one of the Reopen Saskatchewan plan, which means that some medical offices, such as dentists and optometrists, well, they may reopen if they choose. Tomorrow, the Saskatchewan Health Authority will outline its plan for resumption of some services and some surgical procedures. So this week, we begin taking our first few steps towards getting back to normal. Not the normal we once knew, but a new normal. A new normal that means continuing to follow safe physical distancing practices and avoid large gatherings. So thank you once again, Saskatchewan, for all you are doing in helping us continue to flatten this curve. Dr. Shahab, if you had a few comments.
Thank you, Premier. So I'll just reinforce some of the numbers that are presented. And So of the 34 new confirmed cases today, 29 were in the far north, mostly in the Loche and surrounding area, including Beauval, 4 from the north region, 1 from the Saskatoon area. So again, while we cannot minimize the outbreak in the Loche area and of course the outbreak in Lloydminster, which is being managed, we have to understand and appreciate that the case numbers from the rest of the province remain low, and that is entirely due to all the steps that have been taken to date. And as Saskatchewan reopens in a methodological fashion, all those measures that we have been practicing so well, almost as a part of our routine now, almost as a habit, by habit, we need to maintain that. And I also wanted to mention that in the news release, there's a reference to Mental Health Week, and obviously mental health is really important in this time. It's always important, even more important right now. And while there have been many pressures, obviously, if for people facing stresses due to employment or due to just being at home and children are at home, I think we need to rethink that and try to, as much as we can, and it is harder in some situations than others, I appreciate that, but we have to look at it from all the positives we have in Saskatchewan, where it is easy, and we've seen that it is easy to do many things in a safe manner by practicing physical distance. We still can't do a lot of things we used to take for granted before January or even every summer. So we just need to appreciate that and be patient with that. But on the other hand, appreciate the things we can do and do them in a safe manner as Saskatchewan reopens, because this will ensure that we remain on track. And if we can't do that, then things can go awry very quickly, and no one wants to be in that position. So if we don't observe all these steps, we not only put ourselves and our families at risk, we put others who may have underlying health conditions or who may be older at greater risk. So I think we need to continue to respect that, but at the same time, continue to enjoy all the things we've been doing in a safe manner. Thank you.
And we have an opening comment from Scott Livingstone, CEO of the Saskatchewan Health Authority, on the line.
Thanks, Jim. Good afternoon, everyone. First of all, I'd like to start today by again saying thank you to our healthcare workers across the health system, as well as our community leaders across the north. Today, we cautiously take the first steps forward as a province to try to find our way to a new normal in life, which is a necessary step as we look for a path forward. And even though we might recognize that that path is not always going to be straight. For the Saskatchewan Health Authority, outbreak management remains our top priority, and as I said last Friday, it will be critical that we create better and clearer processes to support our medical health officers in escalating the declaration of these outbreaks and facilitating public notification as soon as possible. That's why we will continue reviewing the situation as we are and making improvements as we can go through the rest of our journey with the COVID pandemic. Recognizing the desire for updated information, I'm going to provide a snapshot on where we are today with outbreaks. It is important for folks to recognize that the following information changes literally as I'm speaking, and we always have to do a point in time report out with respect to what's going on in the province, particularly what's going on with contact tracing and in cases by each facility and or community. Our numbers are not automatically updated on a minute-by-minute basis, but I will tell you as of late this morning, here is the update across the province. So in the far north, for the Loche, we are continuing to target screening with a focus on mobile testing as well as drive-through testing. Our priority has been testing contacts and households, but we will continue to expand our door-to-door screening, and as we've already seen from this weekend, we are seeing this increased testing identify more cases. We have deployed a number of resources on the ground in the Northwest, with more arriving every day. We also have 19 staff that are available to support the Loche area remotely. These resources can be rapidly deployed across the entire Northwest as communities are required, and they do work such as contact tracing and entering data to support the work that we're doing. In Beauval, as you're aware, we have an incident related to a positive case in the grocery store, which led to our initial public health alert. We do now have 9 cases between Beauval, Isla La Crosse, Buffalo Narrows, and Jans Bay. Testing is available as a drive-through service on-site at the Beauval Health Center, Buffalo Narrows Health Center, La Loche Health Center, and St. Joseph's Hospital. There are no barriers to accessing testing currently in the Northwest. Communities and our staff are working aggressively with the guidance and support from medical health officers on the ground. For this entire area, there are 98 confirmed positive cases identified, 16 recovered, and 76 of positive cases directly related to Loche. We continue to meet and work closely with the local community leaders. For Victoria Hospital in Prince Albert, we have no new cases related to the Victoria Hospital with only one positive case. Through contact tracing, we currently have 91 healthcare workers identified as close contacts and 7 patients associated with that single positive case. I can confirm that the positive case was related to the Loche. It's important to note that 7 patients are currently under isolation, never came in close contact with the positive patient, but we have opted to screen and monitor these individuals, and all are currently asymptomatic. The large number of healthcare workers that have had minimal exposure are asymptomatic. We've already tested 46 of the workers, and the rest will be completed over the next day or so. This is important because right now we have a reduced amount of services at TA-BIC. ICU remains closed, and other service reductions remain in place. For Lloydminster Hospital outbreak, all healthcare workers identified as contacts have been referred for testing and are self-isolating. Patients are being cohorted in a separate units in Lloydminster Hospital, with COVID-19 patients being admitted. Non-COVID-19 patients will be transferred to other facilities where their care will be provided. Key emergency department services, emergency surgery, obstetrical services remain available and in place in Lloydminster. As you know, testing remains critical for our response, both through outbreak management, but also how we monitor both the reopening of the province as well as a reopening of the healthcare system. The Gen Expert machines are now live across 11 sites, including the North, Prince Albert, Meadow Lake, North Battleford, Tisdale, Isle of La Crosse, Loche, and Lloydminster. In the South, we are live in Moose Jaw, Weyburn, Yorkton, and Swift Current. We continue to look at expansion across the province in the days to week ahead. Finally, I'd like to remind everyone that despite the attention that these outbreaks are receiving in the news, we need you to remember that the healthcare system is there for you. We ask to ensure that you stay connected with the healthcare team over the upcoming days and weeks. As always, Healthline 811 is available for confidential 24-hour health and mental health services, addictions advice, education, and support. I'd like to thank all of those who have supported this COVID journey so far with the work they're doing as a community around public health measures, social distancing, hand washing, etc. And we continue to work together to ensure our health system is there for you regardless of the circumstances. Thank you.
Thank you. We now have about half an hour for questions. We'll take our first question from the phone line operator.
We have Adam Hunter with CBC.
Hi, I'm wondering, we had 100 active cases, nearly 100 active cases in the far north. Can someone explain how this happened, and does the government think it failed in some way in keeping COVID out of this region in such high numbers?
Well, I think how it happened is we had the virus ultimately went into a community, and in this case, likely the community of Loche, and I think it was stemmed back to some people that were working at a camp in Fort McMurray, if I'm not mistaken, and Scott or Dr. Shahab, you may correct anything I say on the medical front. But have we failed in any way? No, most certainly not. We've been working very closely, not only with the community of Loche, but with other communities throughout the north, and in particular in the northwest, to ensure that we are supporting them in their initial initiatives to do what we can to stem the spread of this virus. Now, listen, this is in a number of other communities throughout that northwest. So what we are going to see in the next number of days is a much more active role by the provincial government, still working in lockstep with our northern communities, working in partnership with our northern communities. But you are going to see a more active role by the provincial government with self-isolation units being provided into the community of Loche to begin with. Starting today, I believe 8 self-isolation units will be arriving today. We've already outfitted the school for any surge capacity that we may need, as well as we've provided our Sask housing and our education housing units in the community as well to support their opportunities for people from that community that are required to self-isolate, providing them the opportunity to actually self-isolate and to stem this virus spread. You're also going to see, in conjunction with the northern leaders, an increased presence over the next number of days of the provincial government conservation officers, as well as forest fire suppression employees with the checkpoints that we have throughout the northern areas, but in particular in the northwest, to ensure that we are working alongside community members, and this is how it is in the Loche right now, is we are working with community members at those checkpoints to ensure that we are not only limiting north and south travel, non-essential north and south travel, but we are limiting the travel between the communities so that we can curb the spread of this virus. And how we do that is we need to stay in our community, we need to stay at home, and we need to practice a good physical distancing. We have proven in this province and in other areas of Canada that when we practice good physical distancing and we limit our movement from community to community and within our community, we are able to flatten the curve of COVID-19, and we need to have all hands on deck in that effort in the Northwest over the next number of weeks. And the provincial government has been there working with the community leaders and the communities, and we're going to be there in a larger way in the days ahead. Anything to add, Scott or Dr. Shahab?
Yeah, maybe the only few things I'll add to that is that we, on the one hand, we recognize that with significant discipline, we can flatten the curve, and that's been demonstrated. But we also recognize that there are settings where, whether it's an institutional setting like a long-term care facility, or even a hospital, or where it's other settings where there's crowding within the house or otherwise, there's more social mixing than you would otherwise see. And transmission is higher and it is harder to control. So those are all realities for many communities in the north. We've also heard of many examples of leadership by communities and members of the community where elders and youth, they are taking significant steps to educate each other to minimize this in terms of everyone's role in minimizing transmission, but then of course support that government and other agencies can provide to assist individuals to self-isolate if a case or a contact, if that's not possible in the immediate household.
Do you have a follow-up, Adam?
What would be the conditions for pausing the reopen plan on May 19th? That's something that the NDPs recently said is necessary. We had 60 or so active cases when you made the announcement, Mr. Premier, and now we're up at about 150 active cases. So what are the conditions? What do people need to know about whether you'll reconsider this or pause it or move it? What do we have to see as far as cases for that to be considered?
Well, there has been consideration given to areas where there have been isolated outbreaks. We have put the Reopen Saskatchewan plan on pause in two areas of the province over the course of the past week, one in Lloydminster, which I'll speak to in a moment, and as well as in Loche. It'll continue on pause in Loche for some period of time as we have an isolated outbreak in that area of the province, Loche and some surrounding communities, of which, as I said, you are going to see some increased activity of the provincial government working with our communities to ensure that we are able to settle things down and get that outbreak to a better place in the next number of weeks. In the case of Lloydminster, it appears that we are starting to get the isolated outbreak that we had in the healthcare center in Lloydminster to a much better place with the contact tracing, the testing that was implemented immediately, I might add, that we seem to be making our way with respect to addressing the concerns that we had with the isolated outbreak in the community of Lloydminster. So we'll have more discussion on that in the next few days with respect to whether or not Lloydminster can re-engage with the Reopen Saskatchewan plan and at what point that would be appropriate, as it appears that we're getting to a much better place in the case of Lloydminster. So we have looked at the Reopen Saskatchewan plan in certain areas when required, and I believe the areas that we have looked at it in are appropriate, understanding that the large majority of the numbers are coming out of one area of the province, and for all intents and purposes, the bulk of the communities in the province are much, much quieter.
We'll take our next question from the room here, Steph.
Yeah, for the Premier, how many more conservation officers and fire suppression staff are you going to be sending further north? And are people just not listening to the advice to stay home? Like, is that why more staff from the province are being dispatched to kind of man these checkpoints?
Well, three things on that. One, I don't have the number, but it'll be the necessary amount that we need. And again, as I said, we're just looking at our emergency, our incident command, if you will, to ensure that we are setting up the chain of command in this particular area of the province in very much the same way that we would react when we have a forest fire or when we have a flood. So there is a chain of command between government and a chain of command that allows for input from the local communities in the decisions ultimately that are made. And part of those decisions will be around how do we limit the movement between communities, both from the south to the north, but also between northern communities to stop the spread of the COVID-19 virus. So I don't know what the number will be. There's substantial resources that have been moved into the area already, and there will be more that will be on the way. So what is required is what that number will be. The second piece to that, what was the second part of your question again? Sorry.
Like, what are people not, like, you've been saying this
yeah.
for a week for people to stay in their home
Right.
community, and now we're seeing more staff dispatch. I'm just wondering if people are not actually listening to that travel restrictions.
Well, some of the exemptions to the travel restrictions actually are in many ways exclusive to the situation in the north. As you look at each community in Saskatchewan, some of the reasons for travel, some of the reasons for movement are different. For instance, there are northern communities that don't have a grocery store. So you need to go to a neighboring community to actually access your groceries. The northern communities bring a much different dynamic, if you will, than maybe what we're used to in many of the southern communities. So that's why it's so important for us to work in lockstep with the northern leaders on what is available in their community. How can we ensure that these services are being provided? That's why we're sending up a number of isolation units, understanding that there are not vast amounts of rental properties that may be vacant and open for these individuals to use. So the third point I would make on this is indicative, I think, of how this virus can spread if you let your guard down for a moment or not expecting it to be in your community. And this is something that I would like to say to the rest of our provinces. We need to keep our guard up, because if you let it down for a moment with respect to physical distancing, if you let it down for a moment with respect to ensuring that you are taking every precaution when you're out shopping, when you're out and about, if you let your guard down for a moment and start leaving your home for too often, if you will, increasing that opportunity for exposure. The infection of COVID-19 can be very rampant. It can be very quick throughout your community. So in the days before the infections that we are seeing in the north today essentially happened 10 days to 2 weeks ago. That's when we were just starting to talk about the numbers starting to increase in the northwest. So it's our hope that as we move forward through the next few weeks, that we will see that curve start to bend in the northwest. But in the next number of days, I don't think that it should be unexpected that we may see some relatively large numbers throughout that area for a number of reasons. As one, we're going back to about 2 weeks when the infection started, when maybe physical distancing wasn't the priority it is today in those communities. Two, we're testing more in those areas. We are very much, as I said many times, we've increased our testing capacity so that when we need to utilize it, we are able to utilize that. And so we are testing more in the communities of Beauval, in Loche, in all of our northwestern communities, to ensure that we are able to identify those that are positive with COVID-19 and provide them the opportunity to self-isolate. So the resources are there, more on their way. And we're confident that we will be able to work with the local leadership to ensure that we get our cases in the northwestern part of this province in a better place over the course of the next number of weeks.
Do you have a follow-up, Steph?
Yeah. We've seen like 3 isolated outbreaks. One, the patient in the Victoria Hospital tied to the Loche, so clearly there's a little bit of movement happening. 34 cases in one day, that's our largest thus far. If that doesn't give you pause for moving ahead with the Reopen Saskatchewan plan, I guess what would then?
That does give us pause in the area where those infections are occurring, and we are pausing it in the community of Loche. So we have been, very much identifying with what is happening on the ground and reacting very quickly to that. We seem to have isolated the case in Prince Albert, and it's our hope that the case count is not going to grow there. We seem to be managing the Saskatchewan Health Authority and those that are doing the testing and the contact tracing in the case. The outbreak we had in the community, the hospital of facility in Lloydminster, we seem to be getting that to a manageable situation. So there's the vast number of communities across this province are pretty quiet when it comes to infections. So we should be moving forward with our Reopen Saskatchewan plan in those communities. And I would just pause to again reaffirm that our Reopen Saskatchewan plan is a very cautious and methodical plan. We are moving forward with a number of medical services that may choose to reopen, can reopen today: dentistry, opticians, a number of really medical services that just have not been provided for the last number of weeks. In 2 weeks, we'll be moving forward with our phase 2 in the vast majority of what I hope would be the vast majority of this province, barring any localized outbreaks like we have experienced in Loche or to a lesser degree in Lloydminster. And we are hopeful that if the people in this province continue with the rigorous self-discipline and physical distancing that they have over the course of the last number of months now, that we will have very positive and favorable results as we find our way through reopening these sectors of our economy. I guess that's all I have to say on that.
We'll take our next question from the phone line, operator.
We have Carlisle Facette with Global.
Hi there. I'd like to circle back actually to part of the question that Adam had asked previously and maybe get Dr. Shahab's perspective on this. Is there a threshold in cities where currently the curve is flat, that if there are new cases that suddenly that would affect the reopen plan? Is there an actual threshold?
So there's a couple of things that we are keeping an eye on. One is, of course, the modeling group is providing now weekly updates on the RT, the actual transmission rate. So overall, we want to see that below 1. Now, that came down to, I think, as low as 0.73 a couple of weeks back. It's creeping up to about 0.93 now, and most of the upward pull is because of events in the Loche. So we have requested the modeling group to analyze that as a whole province, but also as different parts of the province, with and without, for example, localized outbreaks. So that's one number. The second, which we've said in the past, is that we did see a high number of cases initially, but they were all linked to travel. We could identify the exposure, we could identify all the contacts, and then all the contacts in cases self-isolate, and there's no further transmission, and that's how the curve remained flat. Even if we continue, and right now we are seeing on average less than 10 cases a day in the rest of the province, excluding Lloydminster to a small extent and the Loche and area to a large extent. The rest of the province we're seeing less than 10. Even if we were to see 20 or 30 cases a day in the rest of the province, and we could confidently identify the exposure setting, that's one thing. But if we start seeing those numbers creep up throughout the province or in a specific area, we need to look at that very closely. What is the setting that is causing the exposure? It may be something we understand, being a close contact of a case, or it may be something we have not seen before. And so we need to understand that, mitigate that. But certainly if our overall numbers throughout the province start creeping up and there's no identified exposure, I think that would be something that would be a cause of concern. Certainly if our overall numbers in the rest of the province are less than 10 currently, but if they start creeping up 20, 30 in a particular part of the province or overall, I think that would be something we would need to start looking at very closely.
You have a follow-up, Carlisle?
I guess this might be a bit more of a semantic question, but I know I'm referring to the province's curve as a whole. At what point do we have to sort of put an asterisk next to that, given how steep we expect the numbers to be in the north when we talk about the province as a whole?
I'm sorry, could you just repeat that?
I'm talking more about just referring to the province's curve as flat when it won't look very flat given the numbers that we're seeing in the north. So I guess when we're talking about a flat curve in Saskatchewan, is there an asterisk next to that now?
So in the past, throughout the time that we've been tracking it, and we can try to show that in more detail with a graph or a table, we look at our overall numbers, and that's important to look at, but we also look at the context of the transmission. So, for example, for the first 4 to 6 weeks in March and early April, most of our cases were travelers and close household contacts of travelers. So it is not just the case numbers, which on some days were pretty high, but the fact that because we could link them to people who had traveled back to Saskatchewan or their close household contacts, we will explain that. And then in the next 2 to 4 weeks, we had a couple of large number of cases presenting over a few days in Saskatoon and in PA and area linked to mass gatherings. So obviously that is concerning, but because we could explain that they were linked to a mass gathering, and because they were able to isolate, and they did generate in some cases additional cases who were close household contacts, we did see a bit of a blip, but we could explain that, and that is controlled, and there was significant limits placed on mass gatherings, which remain in an ongoing fashion as Saskatchewan reopens. So I think that is the whole point, that, and then now we have a very concerning outbreak in northwest Saskatchewan, the Loche area, that is explaining a lot of the increase in case numbers. So it's not minimizing the fact that there's an outbreak that is significant and needs to be managed, but it is localized to a part of the province. And similarly, there's a smaller cluster in Lloydminster area, which again is concerning, but it has been explained as linked to the hospital and close household contacts of cases linked to the hospital. So again, while there's some caution towards the city of Lloydminster, that is of a lesser concern, because most of the cases to date are linked to that cluster in the hospital and not to ongoing high transmission in the city. So I think we have to, and that's the whole point of testing and case contact investigation. It obviously informs the person that you are COVID positive, you have to isolate for 2 weeks, your close household contacts have to isolate, but it also informs the bigger picture in terms of what is driving the transmission. So we need to constantly keep understanding that as we move forward.
We'll take our next question within the room. Arthur?
So we just heard from you. We just heard that the upshoot in cases that we've just seen is kind of connected to the more aggressive kind of proactive testing that we're doing in Northwest Saskatchewan. At the same time, elsewhere, things are very flat, but I'm just wondering, how can we know that without doing the same kind of proactive testing that we're doing in La Loche, elsewhere, in other communities, to ensure that we don't see those kinds of cases cropping up that we've seen today elsewhere, and know that it is safe to move ahead?
I think in many cases, I'll answer quickly, and then Dr. Shahab or Dr. Shaw or Scott Livingstone if you want to add, but in many cases, we are. We are doing contact tracing testing and testing the contacts of anyone that has come in contact with someone that has been tested positive for COVID-19, whatever community you live in. The fact is, and that was shown in Lloydminster. That contact tracing and testing picked up immediately. The same in Prince Albert with the incident we had in Prince Albert. The difference in La Loche is we have a number of more contacts to follow up on and to test as well, because of the larger number of cases that we have per capita in not only La Loche but in a number of northwestern communities. We are in the process of going further with some surge testing in that community. So the testing of contacts, people that have come in contact with someone that has been tested positive for COVID-19, continues to be very aggressive right across the province. What we are seeing is lower testing rates in many of those communities because of the lower infection rates that we have. Anything to add, Dr. Shahab or Scott?
So I'll just add a few comments. So we understand that with cough and cold season on the way out, we did see a decline in testing overall, but we absolutely need to see some baseline testing happening throughout the province. And we really encourage anyone, even if it's allergy season now, that if they have a cough or a cold, which seems a bit different from their routine allergies, to consider testing. If it's even, they're pretty sure it's allergies, that's fine. But if there's anything unusual in people who get a cough and cold this time of the year, we really want to encourage testing throughout the province, because that may help identify COVID-19 in a person who may not otherwise be aware of that. They may be dismissing it to an allergy, but it'll help to inform the bigger picture throughout the province. So we absolutely want to support testing, especially with even mild symptoms throughout the province.
Follow up, Arthur?
But why not take the strategy that has worked well in Loche to turn up some of these hidden cases, things like door-to-door testing, things like these sort of active outreach groups, and apply that elsewhere so that we can be sure that there aren't hidden cases throughout Saskatchewan that we might be missing through this symptomatic or contact-based testing?
So, even so, when you do in the setting like Loche, when you do door-to-door testing, for example, you primarily want to focus on testing close contact who are symptomatic, or if there's a situation where everyone can't isolate, you want to sort out people who may be infectious from others who not. Beyond that, if you have a situation where overall case numbers are low, like in the rest of the province, in any community where there has not been a case, in many parts of Saskatchewan, there has not been a case for many weeks. If you went door to door, you would, for the most part, find negative cases, which is what you'd expect. There'll be little gain. Having said that, if there's a single case in a long-term care facility, all residents and staff are tested, primarily to rule out in that high-risk environment, are there asymptomatic or mildly symptomatic cases in staff and residents, so that you can quickly try to separate infectious from non-infectious. So it is applied in a focused way in settings where there's high risk, but the gain from doing that broadly in situations where case numbers are low would be very little.
We'll take our next question from the phone line, operator.
We have Murray Mandrick with the Leader Post.
Hi. I'm wondering how there's been a lot of concerns actually related since the Loche outbreak that it just cannot be contained to a small community in the north or I guess in the south, simply because if you're in a small town, you're going to other communities for not just commerce activities like shopping, but if in the case of a COVID outbreak, in Loche, you have to be flown out for medical services. So I guess people are a little skeptical with the opening of the province starting today, how it's possible to, when you have an outbreak, to contain it to any community, let alone a northern community where it's very intense. And I guess the question becomes, well, what happens if it happens in a southern community? How does one necessarily contain it to that community without it having to affect someone else in another center in the province, in hospitals or otherwise?
I would say we should go back to, this would be a time for us to go back to, our initial efforts when it came to addressing COVID-19. And those efforts were essentially to flatten the curve so that our healthcare system could manage ultimately what some of the predictions were showing at that point in time. We are achieving that. We are flattening the curve, most certainly flattening the curve to a level where our health system, our healthcare delivery system can manage at this point in time the 11 hospitalizations that we have. We won't eradicate COVID-19 in Saskatchewan ultimately until we have a vaccine, when it would most certainly become very, very controllable, would be the hope. But we aren't going to be able to eradicate the spread of COVID-19. No one has been able to yet, as we've seen this spread around the world virtually, and it is now in our country, in our province, and we should assume it's also in our community here in Saskatchewan. So eradication is not possible and is not the goal. The goal is to minimize the spread of this virus in our communities. We have always said we will have isolated outbreaks in facilities and in communities. We have that now in the Northwest, and we're going to make every effort to stop the spread, to slow the spread of that virus in those communities, and to push our active cases down. So eradication is not possible with this virus. Eradicating it out of one community even, I think, is not possible and not a realistic goal. The goal is to keep our infection rates low enough so that our health system can manage the infection rates here in our province, and so that the minimum number of people are actually exposed to this virus until such time that we can have access to a vaccine.
You have a follow-up, Maria?
I guess so. How can you be confident that you've got the stage planning right in terms of your Reopen Saskatchewan plan? As per, I guess, Opposition Leader Miley's suggestion of delaying the second phase, why not delay it a week or two until you see what's coming out of Lloydminster, what's coming out of Loche, to ensure that it is not spreading elsewhere? If you're acknowledging that you can't eradicate it, don't you want to make sure, as you suggested earlier, that you're doing everything possible to avoid outbreaks and spreads elsewhere?
Well, we are doing everything possible to ensure that we are limiting the spread of this virus. We have put together a slow and methodical plan. We see a number of provinces that are moving quite more rapidly than Saskatchewan in opening a wider suite of businesses and services in their communities and in their province than what you see even here in Saskatchewan. That is why we left a number of weeks between Phase 1 and Phase 2, and that's why we have not yet set a date for Phase 3, is so that we can react to anything beyond what might be a localized outbreak here in the province. So it is a slow, methodical plan that has been put together with input from a number of entities, but most significantly, the gentleman sitting to my left, Dr. Shahab, has worked very hard in conjunction with the Minister of Health, Jim Ryder, as well as a number of other entities throughout the health system and our business community and our communities as well, to come up with what we believe is a very pragmatic approach to safely reopening sectors in our economy. We must also recognize that many sectors of our economy and many businesses, as I mentioned in my opening statements, have been open over the course of the last number of months, and in many communities across this province have been open and have been able to flatten the curve in their communities. So we have the greatest faith that employers, employees, and customers will continue to practice good physical distancing in their daily activities, whether they be at work or whether they be out shopping or doing whatever they may do throughout the day. I have the full confidence in the people of this province that we will be able to cautiously and methodically open up sectors of our economy while being able to manage the spread of this virus.
We'll take our next question from the phone line, operator.
We have Lisa Schick with CJME.
Hi, this first question, this is for Premier Moe and Dr. Shahab. It's the first day of the Reopen Saskatchewan plan, and we end up reporting our highest number of cases. It's kind of right when we need to have things under control. They seem to be jumping up. So how are you both feeling?
So obviously, whenever there's a significant outbreak like there is in Northwest Saskatchewan, it's always concerning. But I think, like we spoke to earlier, we need to understand the setting and the transmission. And although the outbreak itself in Loche is very concerning, and there's significant efforts to manage that being put in place by the government and by the Saskatchewan Health Authority, the cases in the rest of the province remains flat. And so that is why it is important to move ahead with the Reopen Saskatchewan plan. And I also wanted to say that, like the Premier mentioned, the precautions we have to take individually and collectively at home, at work, and play will need to continue for the next little while. And as we reopen, there will be concerns that will come up, as we reopen progressively, as we enter the fall. There's lots of things that we could expect to see that would be a concern and will have to be managed in a systematic way. It may not always mean ramping back things entirely throughout the province. It may mean ramping things back in a certain part of the province, or looking more closely at the transmission setting and just focusing on where the issue seems to be. And in that way, I think we can all learn to minimize transmission as much as we can protect the most vulnerable, because I think we can never take our eye off that priority. We must ensure as we reopen that we protect those at highest risks in long-term care facilities, personal care homes, individuals, friends, family who have underlying health conditions. So even as we interact between 2 or 3 households, always being extra cautious around those at highest risk. So as we move along, we will see some local areas with increased transmission, and we'll have to understand and manage that. But at the same time, we hope to proceed with reopening in a systematic way while keeping case numbers as low as we can.
Do you have a follow-up, Lisa?
Just the same question to the Premier.
Yeah, how am I feeling? On the whole, as we start to reopen Phase 1, which is a very cautious portion of the Reopen Saskatchewan plan, I feel quite confident. As you look at the numbers across the vast number of communities in this province, I feel confident that we are taking a very practical step forward in starting to open up some segments of our economy. If you ask me what I'm doing and what I've been doing over the course of this past morning and the course of the weekend, is I've been monitoring very closely the potential and the isolated outbreaks that we have in Prince Albert, which we seem to be managing quite well with some reasonable early term results. Lloydminster, which we seem to be seeing getting to a much more manageable situation, and most in particularly the cases in Loche and throughout the Northwest. And I spent the weekend talking to northern leaders, ensuring that we are supporting not only their initiatives, but how this province can take a more active role in ensuring that we do also get our COVID-19 infection rate in the Northwest into a much more manageable position. And there is some challenges with respect to some of the northern leaders that I had talked to are very challenged as they see just the initial communication and education coming into their community over the course of the last 2 weeks around, what does proper physical distancing actually entail, and repeatedly talking and communicating that to their community members so that everyone knows what proper physical distancing is, and two is abiding by the health orders and the physical distancing suggestions and recommendations that have been put out there. We've been talking about how we can continue with our surge testing in the communities and how that would be most effective, how we can deliver on additional isolation units as our public housing units are beginning to fill with people that are self-isolating in those communities, and how we can take a more active role in ensuring that the checkpoints are as effective as possible, as now there is a public health order in place that can be enforced, but can only be enforced by law enforcement officials, individuals such as conservation officers and such. So how am I am feeling quite confident on behalf of the vast majority of communities in this province as we take this step today that really has never been taken in this province before, and no one has had to or been required to reopen an economy in a province. But what am I doing? I'm working very closely with those isolated outbreaks that we have, with the gentleman to my left, and another individual that is working day in, day out, weekend, weekday, is our Minister of Health and his whole team within the Ministry of Health and the Saskatchewan Health Authority.
We'll take our last question from the phone line, then we've got a couple more from the floor. Operator?
We have Matt Young with CTV.
Oh, hello. I have a question likely for the Premier. He talked about having more conservation officers up north to sort of limit travel between different communities. Can you expand a bit further on that? So are we going to see conservation officers on more roads? Are we going to see them in more places? Are they going to take a sort of a firmer attitude towards this? What can you provide in terms of details on that?
Well, I'll try to keep this answer as brief as my previous answers. But yes, you will see more conservation officers on the road, not only within the Northern Administration District, but south, and as we transition on the Forest Fringe, where I live, for example. Yes, you will see conservation officers working alongside communities in the checkpoints that we have, as they are the law enforcement entity that would be able to actually enforce the public health order that is put in place. You'll see our incident command center up and running in the next number of days in a much more structured form, similar as to when we have forest fires, and we have had forest fires in this particular area. It won't be a structure that is new to leadership, local leadership in the area. So we are taking steps to become more active in the area, but you also see other support, provincial support staff that are there totally to support the community in the way of SHA employees that are working alongside community members in our surge testing efforts. You're seeing a number of self-isolation units that are coming into Loche. I believe 8 will be arriving today. So you are seeing these supports arriving in the communities as we work to flatten this curve in all communities in the Saskatchewan, and that includes the communities in the Northwest.
You have a follow-up, Matt?
No, thank you very much.
Great. Arthur?
First off, on Saturday, there was a protest in front of the legislature. People had some very interesting signs about, like, Open Canada, talking about something with regards to a police state, kind of reminiscent about what we saw in Ontario, where the Premier wound up calling it yahoos. I was wondering if you have any reaction or any message for the people that gathered in front of the legislature with those messages.
Well, I would say, you know, I think these feelings, and I don't agree with these feelings, but I think the feelings that people have speaks to the significance of the action that we have had to take, not only in Saskatchewan, but the action that we have had to take across this nation and in many cases across North America and around the world to stymie the spread of COVID-19. It's really unprecedented. And I'd mentioned no one has had to reopen sectors of their economy like we are having to have the discussion about today, not only in Saskatchewan, but again, in many other areas. So the plan that we have put forward, I have every confidence in, as it has all the opportunities for ongoing consultation with sectors of the business to ensure that they are providing the safest service, or providing their goods in the safest way possible. It has every opportunity to be dialed up or scaled back from a time perspective, but also from a who's involved perspective, but also, as we've seen already, from a geographical perspective when we have these isolated outbreaks. So we feel we have put forward a very methodical and practical approach. It was one of the first plans that were put forward in this nation. We're being as aggressive as we possibly can in reopening the economy here in Saskatchewan, but understanding that it has to be driven by safety. It has to be driven by ensuring that we are continuing to flatten the curve here in communities right across Saskatchewan. So I don't agree with the fact that we should just open up our economy immediately. I think it needs to be opened up, and I feel the need to open it up. We do need the opportunity to get back to our jobs and to our places of employment. There is a new normal coming. It is not what was here 8 weeks ago. It is a new normal where physical distancing is the norm, and the things that we do each and every day are very, very different than they were just a short time ago. So I understand the sentiments and the frustration as we are in an unprecedented time. But I don't agree that we should flip the light switch on the Saskatchewan economy. I am much more of the view, and I think many are, that we need to turn the dimmer switch up on our economy in a very methodical way.
Follow up, Arthur?
There were more than 10 people there, and they weren't physical distancing, so I may ask for some reaction to that. But also, just from Phil, my colleague here, asking whether you think that the kinds of communication issues that led to the delay in an alert in Lloydminster, for instance, have now been totally resolved, and what has been done in order to pave over some of those problems that prevented that information from getting to you in time.
Sure, and Dr. Shahab and Scott Livingstone, you may have a comment on this as well. Listen, I have every confidence in the people that are managing our way through this pandemic. One of them is seated to my left. The other one was out here on Friday. The Minister of Health. I was going to call him Dr. Jim Ryder. He's not a doctor just quite yet, but Jim Ryder. And they have been working day in and day out on talking through every situation and challenge that we may have. I think Minister Ryder had indicated today and last Friday that he was made aware of the situation in Lloydminster on a Tuesday evening. I was made aware Wednesday morning, and we informed the media at our first opportunity, which was Wednesday afternoon. I won't speak to what happened between Sunday and Tuesday evening, I believe, but I would say this. The people of this province can have every confidence that the policy and procedures that kick into place when there is an identified case in the way of testing and contact tracing and testing some more and contact tracing some more, all were performed and performed immediately. That, I believe, is showing in the fact that we are starting to see the Lloydminster outbreak get to what seems to be a much more manageable situation. So I commend our Saskatchewan Health Authority employees, staff, everyone that was involved in the initial on-the-ground response in ensuring that those individuals that tested positive were isolated, and the subsequent contact tracing occurred immediately, and I think it's showing in the results just about a week later. Anything to add, Dr. Shahab or Scott?
Yeah, maybe Scott.
Yeah, just to add a little bit to that, Arthur. The last week we talked about the reporting out to the public of the outbreak in Lloyd and apologized. That is not the place we want to be as an organization with respect to how we inform the public of these things. But to the Premier's comments already, it does not change our actions on how aggressively we went forward with working through it. Some of the things that have already changed are multiple meetings between our medical health officers and Dr. Shahab talking about what the new standard is for COVID reporting and outbreaks. Today you saw a little snapshot of that as we were trying to be much more transparent and timely on providing information, and we will continue to do that. But again, I'd just like to reinforce again, and I know the Premier already said this, but the activity by the medical health officers with respect to how they're doing contact tracing, how we're identifying people for testing, goes on irrespective of public reporting. That public reporting is important, but that does not guide our work. Those numbers are used for us operationally, and we use them immediately. And again, I apologize for the delay. That's on us, and we've worked to rectify that, and we'll continue to improve this process as we move forward.
I would just add to that, in the case of Prince Albert, there was absolutely no delay, just a few days subsequent. Anything else?
And we'll take our last question from the floor here, Steph.
Yeah, I've heard you say, Mr. Premier, that in some of the northern communities, the practice of physical distancing and the education is kind of just starting. Like, how is that possible? Like, is that not a failure on the part of public health officials in some way if we're just starting with some of these education materials and practices?
No, not at all. The public health officials have been working very hard, in particular the last few weeks with respect to putting out every educational opportunity for people across the north to understand how to physical distance, just what's involved in physical distancing. For example, there is radio ads in 4 different languages throughout the north talking about the requirement for physical distancing. But we must also understand that many of these communities are very rural and very remote communities. And if we go back to infection rates that started to climb just a few weeks ago, albeit it was physical distancing was starting to become commonplace in many places throughout the southern areas of the province. It likely, in many cases, had not quite made its way through to the most rural and remote communities in this province. I saw it where I live, for example, which is not near as rural and remote, start to increase quite quickly, but for different reasons. We had an infection with a snowmobile rally not far from the community where I live. It was subsequent to that snowmobile rally, which is a mass gathering, which does not occur anymore, which eliminates or greatly reduces the risk of those numbers of people being infected. But subsequent to a number of people being infected in and around the community where I live, I saw a great awareness in a very quick period of time, if you will. And I am convinced and I am certain through the public health officials that are educating aggressively throughout our north, the leadership in the north that are working very hard at this, and I have talked to a number of them in educating the people in the community, that we will have we do have individuals. I'm convinced we do have many individuals that are taking physical distancing much more seriously today than maybe they were a month ago.
Follow up, Steph?
It is a process and a progress.
just given what you said about, maybe this was a bit of a slower uptick in some of the more remote and rural areas in the province, and given how many of those we do have in Saskatchewan, should not have something more proactive been done then? If there's no fault on the part of public health officials from education, what happened that this slow uptick was allowed to happen?
It has worked in many of our rural and remote communities. Where we had a challenge was what started in essentially one community due to people that were flying in, flying out, working in a camp that saw a fairly severe infection in Fort McMurray area. I believe it was a Curl Lake camp. So, through efforts and initiatives that have been commonplace and encouraged over the course of the last number of years, and finding employment, and actually that community has been lobbying for some time. In fact, Saskatchewan has built their section of the road into Fort McMurray from Loche so that people can get back and forth in an expedited fashion for, in many cases, good paying careers. But that is ultimately what has landed us with this infection in this one particular area of our rural and remote communities. So the education has been happening. It's been ramped up more recently, and it has, I would say, been fully supportive and enhanced by local leadership in all of our northern communities. The awareness most certainly is there in all of our northern communities, and we've seen that in the vast majority of them being supportive of the travel restrictions that we had put in a public health order just a number of days ago now. And we're also seeing that as they are continuing to support a more active role by the province in the days ahead. So still continue to work with our communities on A, education around physical distancing, B, around supporting them with their local initiatives, and C, taking a more active role in ensuring that we'll have a successful outcome when it comes to flattening the curve in all communities, including those in northern Saskatchewan, and most in particularly those in the northwest.
Thanks very much for joining us today, everybody. That's all the time we have. And for those joining us on the line, tomorrow we will have the Saskatchewan Health Authority's weekly update here tomorrow at 2:30. See you then.